see the patient early there in Chennai, because Chennai is a very hospital crowded place. They may be lost there, language problem is there. So which they will coordinate from here. Every movement of the patient will be coordinated by this center, and they will ensure that we the senior doctors are taking care of the patient who are coming there, getting earlier treatment and coming back easily and following them. Suppose I am not there, I am coming every 1.5 months, 2 months. I'll come regularly, but in between patient has some problem. So whom they will reach? So they can reach them easily. This Apollo Trinity Medical Center, where they can pass on the message, discuss with me, make an arrangement of a teleconsultation with me, so that their anxiety is immediately resolved on the same day. So otherwise you come, get a consultation, you think the doctor has gone, what to do. So this all type of connectivity, facilities, helping them to get an assessment, getting the diagnosis and algorithm of treatment, getting to a higher center, the best center in India, to get complex work done, be it a pancreatic cancer or esophageal cancer. Centers are there in different parts of India and nothing, but we always choose the best. If you look for the best, then you have to think of the best hospital in India. And the prices, we think that it will cost be very costly, and it's not. All corporate hospitals are charging the same, because it's a private hospital. There will be some cost by the hospital, so that patient has to pay. And we always consider cost cutting whenever possible. We help the patient. We give concession, discount always whenever we feel the patient is not available. We do that also. And then my request is to all, if you have any issue or particularly gastro related issue which is not looking simple to you, or you have anxiety, or nobody is able to diagnose, come get the expertise, get the expert opinion here in Apollo Trinity Center, and see how your experience is, whether your problem is resolved or not. If you have any issue in between also, we are ready to connect you and resolve it. That will be big help for the patient around Shillong, and we'll be continuing coming here regularly every 2 months to help these people and at their place. I am from Bhubaneswar, but I always feel the patient should be seen at their place during the follow-up, even for the initial diagnosis, which will help them. Thank you.
Can you tell us what is the status of malaria patients? What is the nature of their sickness since you are dealing with them? How acute it is?
Which patient? The patient which
Coming
we
from
see.
malaria, yes.
See, acute patient means somebody is having a acute severe pain. He cannot travel, sir. Normally he won't be first he will be stabilized here. You will see, if required, they can have a teleconsultation only. Because acute pain, how he will be able to travel? Either he has to be airlifted or he has to go by special. But usually what they get an advice. Then once their pain has come down a bit, they come for the definitive treatment to Apollo Hospital. There we see how is the investigation done, with the need special investigation to be done, and it doesn't take time. Within 1 day mostly we get all the investigation done and get the assessment complete. Regarding the type of patients, are what you are telling, we get many cancer patients from this region and northeast region, where like starting from chest, food pipe, the stomach, colon, even pancreatic cancer. And we have treated some. Today also I saw a few of my old patients who have been operated by me, and they have come for checkup. And these are the main patients what come, because smaller issues they won't travel so much, and it is not required also. Mainly when the issue is not resolved for a long time, or you have a major issue like a cancer and you can travel there to get the best treatment. And you have a confidence that there is a center in Apollo Trinity Center here which will help us, and if required we can go and immediately talk to them, and not only that, the doctor comes here. Doctor will see me every 2 months, he will see me. So this is the advantage, even if we are dealing with a cancer and operating a cancer.
Continuing with this question, you said the majority of the patients from Northeast are cancer patients.
What we receive.
Yeah. So do you think that any specific reason could be there behind so many patients coming with cancer cases there?
There are few things which we are correlating, like the lifestyle. We have like taking excessive red meat, one. Yes, sir. And second thing, taking repeated or high volume of hot beverages. Okay. Not only hot beverages, the alcohol intake also. And the smoking. If you take like alcohol, somebody is taking only alcohol, there is some damage. But when he takes alcohol with smoking, that it gets multiplied, not 2 times, it becomes 10 times damage. So that those things, one is your food lifestyle, the hot beverages, alcohol with smoking, because of cold weather. So this all increases the incidence of cancer in this region. Of course, there is a background genetic changes will be there, but environmental factor plays a big role in Northeast, which increases the incidence of cancer. What we can control, I can advise, is like make a good healthy lifestyle. You take a lot of fresh vegetables. You take non-veg, not a problem, but not like only non-vegetarian diet and